where women have different types of health issues and challenges they are facing. First of all, when we talk about health, so according to WHO, refers to the health of women which differs from that of men in many unique ways. Women's health is an example of population health, where health is defined by the World Health Organization as a state of complete physical, mental, and social well being. When we talk about health, we will consider all about these three issues or targets, especially physical health, mental health, and social well being. This is a collection of any type of health or any uh, individual's health, often treated as simply women's sometimes we usually mostly talk about the reproductive health, especially in females. And nowadays we are talking too much about SDGs, Sustainable Development Goals. And according to SDG3, ensure healthy lives and promote well-being for all at all ages. This is the main purpose or main cause of the SD3G, where we want complete health for all genders and without any gap of ages. And our target is that, and our target by 2030 reduce the global maternal mortality ratio to less than 70% 10,000 live births, and ensure universal access to sexual and reproductive health care services, including for family planning, information and education, and the integration of productive health into national strategies and programs. These are the main goals of SDGs regarding health, especially in women. Okay, every woman, every child. For healthy and empowered women, children, and adolescents. When our women get healthy and safe, our children will also do. Okay, this is the some points regarding women health. When we talk about rural and urban women, this is a same same points they are facing, like a different type of sexual functions, different type of fertility management, different and various types of mental health issues, promoting health and well-being. Many women have different UTI infections, breast health awareness. These all types of issues they are facing, even although they live in urban or they live in our rural areas. Okay, when we talk about women health, especially in rural areas, so where they are facing different health issues from warm to trauma. Women's health issues is starting from their adolescence to their mature age. And these are the some special diseases they are facing from their childhood, adolescent, or then older ages. In childhood, they are facing different sex selection, abortion, female malnutrition, different types of nutrition problems. And then we go in adolescent or adult age, they are facing unwanted pregnancies, different types of sexually transmitted diseases, sexual harassment. This is very common in nowadays, especially in our villages, or I can say in urban areas too. Different types of smoking and substance abuses. And when they go in older ages, they can different types of health issues like osteoporosis, different types of bone issues, different types of heart heart issues, and increase in morbidity problems on quality of life. These are about the women's health from warm to dawn. Okay, now we will go in different phases, or we can say life cycle of women and health issues. When they are in their infancy stage, or like their childhood, means 0 to 9 years ages. Different sex selection means many um, I can say in this era, many people prefer male child rather than female childs. In many villages and different types of rural areas, especially in our urban areas, we have seen these different types of cases where sex selection is very much common, and then different types of genital mutilation, discriminating nutrition. Then in their senses, male required more nutrition, more healthy diet rather than female, because male is more strong, or they are the supporting power of the family. So they have to get more nutrition and more fruitful diets. And after that, discriminating healthcare. This is the main issue. And both rates and the causes of death are similar for boys and girls during infancy and childhood in different rural areas. Prematurity, birth, asphyxia, and infections are the main causes of death during the first month of life. Premature babies are very common in our rural areas due to malnutrition of pregnant females. They don't have enough diet or enough healthy diet to bear this pregnancy period. So if mother is having malnutrition and don't have a proper diet, so baby is also don't get the proper diet, and the result is premature babies, which is the time of life when the risk of death is the highest. Pneumonia, prematurity, birth, asphyxia, and diarrhea are the main causes of death during the first 5 years of life due to very unhygienic condition, due to malnutrition, due to unhealthy diet. These are the main factors of this mm, different types of diseases like pneumonia, prematurity, and diarrhea. Diarrhea basically is a gastro disease, and in our rural areas, people is still drinking is not a very clean water. They are still drinking is a very dirty and very much polluted water. Malnutrition is a major contributing factor in 45% of deaths in children aged less than 5 years. Malnutrition is a very common factor in our rural areas, and these are all premature babies due to different types of reason, due to different types of factors, including malnutrition, different types of water and food pollution, and contamination, different types of mental stress, different types of diseases. So this is the result. Okay, when age is going, and then they go into the adolescence age, means 10 to 15 years, and they face early childbearing and abortion. This is also a very common factor in our rural areas, according to Women Health. Every early childbearing and abortion. When any female get this early childbearing, they don't have enough energy. They don't have enough um, power to get deliver any child, even physically, even mentally, both. And other than the different side, they also have different types of sexually transmitted diseases, and then HIV infection. HIV infection and sexually transmitted diseases is a very common cause of death in our rural areas in women's, especially in women's, because they don't have any types of basic, even a basic awareness to prevent this type of sexually transmitted diseases and different types of immunocompromised diseases like HIV, AIDS, cancer. They don't have any idea to how to cope up with these diseases and how they can prevent themselves to them to these types of many lethal or I can say many uh, infectious diseases, undernutrition and anemia. When they don't have enough diet and and especially don't have a healthy diet and don't have the awareness to how to get the proper diet or so they can get anemic or anemic patient. Increased substance abuse. This is also as main or can say major factor of the women's health in rural areas. Okay, when we talk about the 10 to 19 years ages of women, mental health and injuries, self-inflicted injuries, road traffic injuries, and drowning are among the main causes of death worldwide in adolescent girls. Depressive disorder and in adolescents aged 15 to 19 years, schizophrenia are leading cause of ill health. Schizophrenia is basically a mental disorder, and in our rural areas, especially 15 to 19 years ages women facing these types of mental health disorder and different mental mental diseases, HIV and AIDS, like as I say earlier, different types of immunocompromised and immunodeficiency diseases in 2011, about 820,000 women and men ages 15 to 24 were newly infected with HIV in low and middle income countries. More than 60% of them were women because lack of awareness, because different types of our taboos situation. Because in our society, women cannot discuss these types of diseases. They also hide. They always hide these types of diseases. Society, uh, uh, mm, what does the society matter, and then different types of family ethics and our individual ethics. So women don't have any right to discuss these types of issues. So when they don't discuss with anyone or their healthcare facilitator, so diseases is increased and eventually they can die. Globally, adolescent girls and young women are twice as likely to be at risk of HIV infection compared to boys and young men in the same age group. This higher risk of HIV is associated with unsafe and often unwanted and forced sexual activity. This is also a main reason of this types of very much HIV and AIDS in our different rural areas, unsafe and often unwanted. Okay. Early childbearing increases risk of both mother and their newborns, and especially if mother is malnutrition, they don't have a healthy diet, they don't have healthy environment, they don't have healthy mindset. So mother is a very much in stressful condition, and simultaneously the newborn will adopt all these negative factors, and then also they will don't survive. Progress has been made in reducing the birth rate among adolescents. More than 15 million of the 135 populated million live births worldwide are among girls aged 15 to 19 years. Pregnant adolescents are more likely than adults to have unsafe abortions. An estimated 3 million unsafe abortions occur globally every year among girls aged 15 to 19 years. Unsafe abortion contributes substantially to lasting health problems and maternal deaths. Complications from pregnancies and childbirth are an important cause of death among girls aged 15 to 19 in low and middle income countries. Complications occur when different types of factors are present. Not even physical factors are also mentally, and different psychological factors are also involved. Okay, when we talk about the reproductive age, 20 to 44 years. In this age, women have different types of unwanted, unplanned pregnancies. Means that one women have more than five, six, seven, eight, or number of children, and then they go for abortions, different types of sexually transmitted diseases and AIDS, pregnancies, complications, and anemia. When the women have a different types of issues like mental issues, physical issues, how they bear different uh, many pregnancies if they don't have any proper diet, if they don't have any proper aware, awareness to how to develop their bodies to uh, grow more and more to bear pregnancies in different times of period. So they get abortions. Maternal deaths are the second biggest killer of women of reproductive age. And why does this occur? Due to non-awareness conditions. People use different types of, I can say, fake doctors or healthcare providers. They don't have different um, specialized equipment to operate them themselves. So, if the environment is unhealthy or the environment is not sterile, the maternal deaths will also increase. Every year, approximately 27,000 women die due to complications in pregnancy and childbirth. 99% of them are in developing countries. Despite the increase in contraceptive use over the past 30 years, many women in all regions still do not have access to modern contraceptive methods. For example, in suburban Africa, 1 in 4 women who wish to delay or stop childbearing doesn't use any family planning method, or they don't have any awareness regarding this. Tuberculosis is also a very important factor or disease in our rural areas, especially in women. Tuberculosis is often linked to HIV infection and is among the 5 leading cause of death in low-income countries, especially in Pakistan, among women of reproductive age and among adult women aged 20 to 59 years. And tuberculosis is spreading very fast just due to non-awareness condition. People do not have awareness about this, how to cope up the tuberculosis patient, how to manage them, how to control tuberculosis in their society or in their areas, or how to prevent them, to control TB, or prevent their family members and their self also, and especially TB treatment. People do not have enough mm, awareness regarding treatment of TB. Nowadays, TB is 100% treatable disease, but people do not have awareness to how to cope up with TB, how to contact with different TB healthcare providers to get treatment, to get proper and complete treatment. In TB, it's very much necessary or mandatory to get complete treatment to eradicate the TB from root. This is the very alarming situation in nowadays, that in our rural areas, TB and different types of immunocompromised diseases like HIV, AIDS are spreading. Is a speed of bullet, we can say. Now, injuries. Injuries, both self-inflicted injuries and road injuries, figure among the top 10 causes of death among adult women 20 to 59 years globally. Both self-inflicted injuries and road injuries. In the WHO Southeast Asia region, burns are among the top 10 leading causes of death among women aged 15 to 44 age. Women suffer significantly more fire-related injuries and death rather than men due to cooking accidents or the results of intimate partner or family violence. This is also a major issue in our rural areas, especially for women. Why always women burn? This is a thinkable question. Women, in especially when we talk about our rural areas, women burn during cooking. Women burn during any type of family violence. Always women bear this burning. This is a very thinkable question. Okay, cervical cancer. Cervical cancer is the second most common type of cancer in women worldwide, especially in our rural areas in third world countries, with all cases linked to a sexually transmitted genital infection with the human papilloma virus. Due to poor access to screening and treatment services, more than 90% of deaths occur in women living in low and middle income countries. And why the poor access of to screening and treatment? Because because the discussing about cervical cancer is also a taboo. Women never discuss these types of issues, even not in their family members, not with their mothers, not with their healthcare providers, not their care physicians, because of shame. I never understand. Disease is a disease. Why are we ashamed to discuss different types of diseases? Disease never have any gender or age issues. When we talk about breast cancer is a both gender issue, male and female. But whenever we talk about breast cancer, we always discuss females, and females think this is only their issue. But men also have different breast cancer. I know rather than male, female have more cases, but never hesitate to discuss regarding their diseases, because when we hesitate to discuss, we cannot eliminate or treat the disease timely. Due to poor access to screening and treatment, deaths occur even in male and in females both. Always discuss any type of diseases with their family members, with your physician, with your